Thank you.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. My name is Shaima binti Arifin. I will be your moderator for this third parallel session, inshallah. So before we start, I would like to give some introductions. So everyone is given 10 to 12 minutes for their presentations. Then we will have a question and answer at the end of this section. The theme for this session is history, and inshallah, today we have three presenters with us. Um, can everyone hear me clearly?
Yes, we can.
Okay, alhamdulillah, good. Okay, now, without further ado, I would like to invite the first presenter, Professor Dr. Siavasyari, with the title of Iran Structure, Policies and Actions Against the Spread of Infectious Diseases in the Contemporary Period, with emphasis on Corona. However, I think Dr. Siavasyari could not make it with us today, but he did send a recording video. So let us listen to his video.
In the name of God, the Beneficent, the Merciful, Mr. President, ladies and gentlemen, great audiences. This is my great pleasure to be in gathering with you in this conference. The topic I'm going to present is Iran's structure, policies, and actions against the spread of infectious diseases in the contemporary period, with emphasis on Corona. Introduction. The history of infectious diseases shows that the international community has always struggled with the spread of epidemics, and all countries have suffered many casualties. Iran has faced all kinds of infectious diseases in its history, like other countries in the world. The statement of the problem. This study seeks to examine the policies of Iranian governments in the contemporary period, and the present study tries to answer this question. To what extent has the adoption of health policies by previous governments been effective, and what has helped the current Iranian government in the policy-making process to control COVID-19? Policies of Qajar government against contagious diseases. The state of public health in Qajar period. Lack of health structure formed in the background of the spread of diseases, lack of understanding of the relationship between the existence of disease, and almost complete lack of individual and social health were very influential in spreading diseases. States of the health system. Iranian physicians are generally traveling, moving from village to village, and announcing their profession upon arrival. Most of the physicians were urban, although some also went to small towns and large villages. Policies and actions. The first step were taken by Amir Kabir in 1851. He commissioned pamphlets to raise awareness about infectious diseases and to suggest ways to prevent them. The second time the Qajar government took measures to maintain health and prevent infectious diseases was when Nasruddin Shah returned from his first trip to Europe in 1873. A quarantine rule was set up at the borders to protect the country from pollution, and travelers were kept in quarantine for several days. Policies of the Pahlavi government against pandemics and epidemics, personal and social health conditions. The general health situation was critical and unhealthy in Iran during the Pahlavi period. Some benefactors took action during these days. However, because these measures were mostly carried out in the cities and were not very widespread, they could not bring about a tangible change in the situation of the village. The situation of the health system in the Pahlavi period, the lack of specialist doctors was one of the factors that seriously endangered people's health in the Pahlavi period. Facilities related to health care, such as health supplies, medicine, pharmacies, health centers, hospitals, and trained Iranian physicians were sparsely populated and operated mainly in cities. Policies and actions. We are facing a large-scale government effort to fight the spread of infectious diseases. It seems that the growing international relations of Iranian physicians and the increase in the number of modern medicine graduates and the participation in international agreements and conferences were among the practical factors in changing the government's health policy. And this policy change led to the creation of new health institutions such as Pasteur Institute, the establishment of quarantines, and the increase of the construction of hospitals. Iran's policies and actions against post-revolutionary infectious diseases. The health situation of the Iranian people after the victory of the Islamic Revolution of Iran. Many advances were made in the field of health after the victory of the Islamic Revolution in Iran, improving the general health of citizens, increasing medical products in different parts of the country, and reduce mortality are among the things that show growth and progress in the field of health. The beginning of a pandemic crisis. COVID-19 was diagnosed in December 2019 in Wuhan in China. However, its pandemic nature put political systems around the world to the test shortly after its emergence. Each government formulates and implements possible policies by its capabilities, resources, and shortcomings. Following the global spread of COVID-19 on 19th February 2019, Iranian authorities announced the outbreak of COVID-19 in Iran. The spread of the coronavirus was in the country's central area, then it spread rapidly. Upcoming challenges. Despite the efforts of executive policymakers to control the corona, U.S. economic sanctions against Iran have significant impact on policy decisions to control corona disease in Iran. The sudden increase in number of cases of COVID-19, which initially led to the shortage of beds in Iranian hospitals, led to the early discharge of patients from the hospital. Unfortunately, such problems made Iran the second center of virus transmission after China in the beginning. Policies and actions. Some of the measures taken to prevent the spread of the coronavirus are establishment of the national headquarters for combating corona. 2. Informing about the virus and measures to protect the people through the media. Restrictions on commuting in public places such as religious places and shops. For closing educational institutions. 5. Closing sports clubs and so many other things. Conclusion. The ground was prepared for controlling epidemics by policies with the aim of raising awareness and attracting public participation, along with the formation of the basic structures of the health system in the Pahlavi period. After the victory of the Islamic Revolution in Iran, public health was at the forefront of managerial decisions. It can be easily understood that although in Iran at first the weakness of policies was evident, but after a short time, Iran was able to reduce the number of patients and improve health capacity to deal with COVID-19. Thanks all.
اوکی
تمام.
عالیه عالی بچه ما
Okay, we would like to thank Professor Dr. Siavashari just now for his presentation, even though it's recorded. It's very informative for me to know about the Pahlavi government. I would like to ask question, however, he is not around. So let's proceed to the second presenter. Please help me welcome the second presenter, Assistant Professor Dr. Hilal Shaheen, with the title of Disease and Some Treatment Methods in the Medieval India according to Baburnama. Before you present, please introduce yourself, Professor, and the floor is yours. Professor, we could not hear your voice. Maybe you can switch on
Sorry.
your. Okay, all right.
Again, good morning from Turkey to all Malaysia and all you. I am
Thank you.
Assistant Professor Dr. Hilal Şahin from Giresun University in Turkey in History Department. I am studying on Indian culture, Indian history, especially Babri period in India. First, I want to say that I am happy here to. I am happy to be here with you, and I am very excited now. And I have poor English, so for now, very sorry for my mistake and poor English. First, I want to thank the Dr. Mansouri and other academicians, organizers, participants, and audience. Now, can I start my lecture?
Yes, sure. Let me remove this one first. Okay. All right, doctor.
Thank you. My subject is diseases and some treatment methods in the medieval India and especially according to Baburname. Health problems remains a major concern all of civilizations throughout time periods. Civilizations have tried to find solutions by developing their own understanding of this great problem from the past to the present, and it's still going on. Society in medieval India also faced various diseases and health problems, tried to overcome them. In this paper, some diseases and treatment methods, experiments in medieval India and Baburi's periods are discussed. As it will be difficult to examine in detail here, some medical issues, epidemic disease and methods used to treatment diseases, especially in Baburnama, are mentioned in this context. Here we will see that medicine wasn't weak in that period. especially by looking at some medical methods in Baburname, which covers the years from Babur Shah accession to the throne 1494-1529, which has a very important place in Turkish Islamic literature and history, presents the observations of a highly educated Central Asian Muslim ruler. By the way, it's important to say that it is ironic that the dynasty Babur founded was known as Mughal because he was of mainly Turkish origin and also preferred to call himself as a Turk in his book Baburnama, especially Western Babur is called Mughal Empire, and you know them Mughal. And although he often stated in the Baburname, as I say now, he is Turk. Baburname says us medical information is available in medieval India on fever, malaria, dehydration, wound care, pyodermia, lower respiratory tract infections, rheumatoid arthritis, poisoning, and important equation epidemics also among horses, etc. After a little introduction, we can start the main lecture now. As I said before, humanity has struggled with various epidemics and natural disasters throughout history. In the past, it has been very difficult to overcome many of epidemics, pandemics, and natural disasters, both at global and regional level, and even many people lost their lives in these epidemics and disasters. However, during the epidemic periods, countries tried to develop a number of strategies, tactics, and methods within the extent of competing. At this point, the struggles and measures taken have made it possible to prevent the spread of epidemic, but sometimes they haven't been effective enough. The point we want to draw attention to here is that the struggles carried out in traditional societies and modern societies have different characteristics, especially in traditional societies where medicine and technology are not sufficiently developed. The struggles carried out within uncertain constraints cause the diseases to last longer. Societies in medieval India also faced various diseases and health problems and tried to overcome them. We will try to explain the treatment methods of the diseases experienced in the period with examples, as I say, from the Baburnama by drawing a general framework. Contemporary writings are full of information about this. On diseases, the administrations appears to have intervened and tried to improve the situation. Various types of hospitals were established and physicians tried different formulations to overcome the diseases. Babur Shah also worked on the history of illness, hospital, and diseases. According to information given in his book, it's possible to say that there were separate rooms for male and female patients in the hospitals that developed at that time. And at the same time, as present today, patients with infectious diseases are brought to hospitals and treated in separate rooms so they don't mix with others peoples. In addition, there are special examinations for patients who are physically disturbed. And we should say that the surgical department developed in that time. Studies on Yusufi, who was the private doctor of Babur Shah, also gave information about the hospital, diseases, and physicians. In Yusufi's work, extensive information is given about mouth, teeth, stomach, head, and all other types of diseases. Because of Babur Shah interested in medical, He brought a number of expert personal physicians in his court. According to Babur, 33 surgeons in Central Asia could own the rank of a Bakshi. Bakshi is original term. When we come to the epidemic COVID, in Delhi, where the COVID-19 graph is currently trending sharply upward, it was an epidemic that helped end of the Babur Empire. Over 150 years ago. We can emphasize that in the early years of Baburids, an epidemic plague started among animals and many animals died that time. Other we can say in medieval India, plague often appeared in epidemic form and seasonally. It occurred during the hot season and usually coincided with famines. Its recurrence indicates environmental conditions as an important factor. First, Ibn Battuta also informs us that bubonic, I think it's true, bubonic plague broke out in Delhi dynasty period and it took a heavy toll on human lives. Also, during the Babrid period, plague was seen among the people also. Plague, it's I think calling plague. It's true. As I told at the beginning of my speech, it's known that medicine wasn't weak in the period of Babur Shah. It's necessary to give information about how the field of medicine developed in the Babur period. But we have no time today. After published, I hope this paper you can see more detail in it. Babur Shah gives information about his mother's illness and death while telling about the case of his work. In the month of Muharrem, Babur Shah's mother, Kutluk Nigar, fell in with malaria. The physicians try to treat by taking blood, but they can't get a positive result. We can see an example like this between when Babur Shah got sick. Babur Shah suffers from malaria too, and blood is taken from him too. As Babur Shah stated, the bloodletting process is of no use. During malaria, Babur Shah had a fever every day or every 2 or 3 days. When he gets hot, he sweats badly. It was getting worse with each passing day and 10 or 12 days had passed. In this case, Molla Hajeka or Molla Hajik gave a wine mixed with Knendula. In Turkish, Nergis flower. He drinks the mix wine once or twice and it's no use. This illness of Babur Shah doesn't pass for a long time and other method is applied. The applied method has also been observed during laxatives. He drinks laxatives for 3 days and this method is useless too. When the illness doesn't disappear within 3 days, Babur Shah couldn't walk due to his illness and the soldiers him carried with a palanquin and his illness didn't pass for a long time. He wrote all this in his book Baburname. It's also written that Babur Shah's son Humayun also had malaria. And when Babur Shah heard this, prayed for his son to be well and to be sick again himself. And eventually well again and suffered from malaria again. And Babur Shah couldn't get rid of it. His daughter Gülbeden is writing in Humayunname also this knowledge. He says that because his situation was difficult, I sacrificed myself to him. He was so valuable for me. He is my son, that I can't stand his weakness. I fell ill and collapsed, he wrote. In the year 1530, he died in the charba, which he built with his own hands. After Babur Shah, during Akbar's period, Abul Fazl informs us, an epidemic in the form of malaria carried off an innumerable people in 1575. It took the life of not only common people, because the author of Ain mentions also significant nobles such as Munim Han, Haydar Han, Mirza Kuli Han, Ashraf Han, Abul Hasan, and etc. died from because of malaria. In 1619, again in Agra, about 100 people were dying daily. The bubus had formed under armpits, in the groin, or below the throat, causing death. It's strange that in all these 3 years, infections separate to all towns and villages in the neighborhood of the city, whereas there was no trace of it at Fetehpur Sikri city. In 1632, plague broke out in Surat, adjacent areas, in the following 2 years of famine. Signor Willibrand gives a very pitiful account of 2 years of famine and the great plague following, which swept away so many that at places there was no left to burn the dead. Many among the English too lost their lives, including President Russell. He died also. Modern medical science has widely accepted the reason for the separate of plague given in the medieval chronicles of memories. Plague not only brought its wake immense misery and suffering for people, but also disturbed social, economic life and put a great strain on the administrative machinery of the state. And other smallpox disaster was also another epidemic of India since long that period, coming most during the hot season. Like plague, it too was responsible for a high rate of mortality. The earliest reference to smallpox in medieval India is in Biruni's Kitab-ül-Hind book. About the treatment of smallpox, Al-Biruni informs us that patients were given cloves to drink together with gold dust. He seems confident that if these were taken, 9 out of 10 people had to change the survey. Conclusion. Here, it was tried to summarize the medical information, especially in Baburnama, by mentioning some diseases and treatment methods experienced during the babies. This study also shows that both climatic and biotic factors were responsible for the spread of various types of diseases in medieval India. As the scholars emphasizes the concomitant disappearance of populations from particular regions, large-scale migration, ecological emblements, and heavy loss of human life affected both the society and economy of the times. In most of the society and economy, in most of cases we have discussed, environment seems to have been a major determinant. Deficiency in rainfall during the monsoon led to famine that was naturally accompanied by different kinds of diseases and epidemics. Moreover, the urban growth of barbaric period in India calls for an understanding how issues of sanitation, disposal of waste, etc., may have had a bearing on the subject under discussion. It is obvious from our study that the medieval medical system couldn't find any remedy for and any solution for such problems exactly. Thank you for your patience and sorry for my English again. I think it's time over. My lecture is over now. Thank you.
Okay. Thank you very much, Assistant Professor Dr. Hilal Shaheen, for your remarkable presentation just now. We are very honored to have you with us here today. I personally myself is very interested with this new topic for me about the medieval uh,
India.
India medication. Yes. I noticed that we have two guests with us here. Welcome to the virtual international joint conference on COVID-19 global impacts. Now, next, I would like to call upon our third presenter, which is the last presentation for this session. Um, Professor Dr. Hussein Ali Begi, with the title of Reflecting the News of the Spread of Infectious Diseases in the Newspaper of the Pahlavi Era Until Today, a case study information newspaper. Please welcome. Assalamualaikum, Professor Dr. Siavashiari. Are you there? My deepest apology. We have technical issues on Professor Dr. Hussein Alibegi. The video that we received from him is too large for our internet connection, maybe, so I could not proceed with the presentations and the video that he sent. Now, I believe we can proceed to our question and answer session. Okay, we will now open for the question and answer session. If you have any question, you can type on the private chat or switch on your microphone and ask questions to either Dr. Shavashiari or Dr. Hilal Shaheen.
There is no question, I think. But I want to ask a question to you. Can I ask you?
Sure. I'll try my best to
How,
answer.
thank you. How is COVID now in Malaysia now?
In Johor Bahru, we are still in the MCO, the movement control order, so we cannot travel to another states. So in Johor, we have to be in Johor Bahru. So those who are in Kuala Lumpur, they have to stay in their own states. But Alhamdulillah, for now, we can go here and there. It's just that we are still practicing the standard operation order. We have to wear mask and also, you know, the gap
Yes,
between one
yes,
person to another. Yeah, and if we
I
go to a
know.
restaurant, yeah, we have to like sit only for 2 or 3 people. And how about in your country?
In Turkey,
Yeah,
same in Malaysia, like
yeah,
all over the world, we are
yeah,
wearing mask and
it's the
very
same. We
attention
exactly, we'll try our best to
after all.
do, yeah, to
Yeah,
take care of ourselves. May Allah keep this disease away from us. I mean,
Amin, inshallah. Thank you.
Professor Siavashari, how are you? Do you have anything to say? Do you have any question for Dr. Hilal or for me myself? I don't know. We cannot hear your voice, Dr. Shabasiari. Professor, I cannot hear your voice. Professor Dr. Hilal, can you hear his voice or is it
Yes, I
you
am
can?
hearing you. I can
No,
see, I can
can
hear
can you
you.
hear Dr. Shabasiari?
No, I can
No,
hear. I can hear anybody except you.
Yeah. So while waiting for Dr. Shavasiari to solve the problem, I would like to ask about the medieval method just now. Is it like a traditional medicine that they use in Turkey as well?
Sorry, again, please.
Uh,
Traditional
uh,
medicine in Turkey.
yeah, the one that you said, the treatment methods in the medieval India, is it practiced as well in the Turkey, in Turkey?
About
Is
COVID?
it- No, this one, the Baburnama, the method.
Sorry.
Yeah, the
As I say
medieval.
you,
Mhm.
I have poor English, so I can't
No, it's okay. It's okay.
understand
I'll try my
exactly.
best. Yes, I'll try my best to use a simple English.
Okay.
So
Uh,
the medieval India, yeah, is it practiced in your country, in Turkey, or
yes,
is it
yes.
from Turkey? Uh-huh.
Is it from Turkey? Yes.
Yeah. So what type? Example? What are the example of the traditional method that is still used now until today?
No, no, no. It is in the past. A
Only in the
tradition.
past.
Yes,
Ah,
only in the past.
uh,
Only going on the diseases and epidemics going on, like
mm,
past. But traditional treatment methods in the past.
okay. So it's not applicable now in this new
Yes,
era? No.
in the past.
Okay, I see. Dr. Shabasiari, I still cannot hear you. Or is it from here? I'll try my best to get you from here. Awa, awa, siapa? I can hear you now. Dr. Shabasiari, I am very sorry. It was my mistake. I have to put you on the stream so that I can hear you. Now I can hear you. You can. Dr.
سؤال
Shabasiari, it's okay. I can hear you now. I can hear you now. Already. We can hear you now.
Thank you.
Yes, I'm so sorry. It was from my part. I have to put you on the stream so that you can speak. Do you have any question for Dr. Hilal? Or Dr. Hilal, do you have any question for Dr. Sabasiari?
No, I have no question. I hope I hope there is no question because
Oh no. How are you, Dr. Sabasiari?
Thank you very much.
No problem, no problem. How's everything in your country? The COVID-19?
It's not bad. It's
Mm,
okay these days. It's not bad.
I see.
Every day about 100 people dies.
Oh, la hawla wa la quwwata illa billah.
100 people died and not bad. It's very
Not bad because
tragic.
about 2 months or 3 months ago, every
Uh-huh.
day died about 500%.
La hawla wa la quwwata. That's a lot, right?
These days it's not bad.
Oh, that's why you said not
Population,
bad.
yes. Population, how much population is there in
About 80 million,
18 million?
Mm.
Like Turkey,
like
80,
Turkey. Okay,
83
yes,
millions, I think, in Turkey.
like Turkey, like Egypt. These
Yeah.
three countries about 80 million.
Mm. Okay, let me put everyone in the stream. We have here Masood Kaidas. Did I call the name correctly? Yeah, and also Isra August. If you have any question, we still have time.
Yes. They are from Turkey.
I see.
Yes, they can ask questions. Mr.
Excuse me, where are you from? This is Hilal. You are Hilal?
No, Dr. Hilal is from Turkey. Oh, she left
Ah,
already?
from Turkey.
Yeah, she's
Yes,
from
she left.
Turkey. Yeah,
She left. She left the room.
she came back. Hold on.
We
Can
are
you
only 3%.
Yes, supposedly we have one more, Professor Dr. Hussein Ali Begi, but he could not make it.
we have a problem. I didn't know yesterday, but we must connect to the conference by filtering. We have problem. We have problem by StreamYard. Only
but we received your video today. Alhamdulillah, it was good. Yeah.
Yes,
and
internet connection
I
is
have
bad
a question from
Yes.
Associate Prof. Halal Shaheen. You are working in the which department?
I am working in history department. History department on
Which?
medieval India, especially Babri period.
Excuse me?
Mughal period. You know, you are calling wrongly Mughal. You know,
Thank you.
Babur Shah is Turk and Turkish period. I am studying on Ekber, Humayun Shah, medieval India, Indian culture, Indian-Turkish relation from past till today. Like this. How about you, Mr. Yani?
I am associate professor in Department History, Ilam University.
Very good.
Yes.
Nice to meet
Thank you.
you.
Thank you. Thank you very much.
Thank you.
I'm delighted to introduce Dr. Ertuğrul from the University of, which university? Scholar University, who will speak on development of LSTM and CNN-based hybrid deep learning model to classify motor imagery tasks.
So if there is no question, I believe we can end our session for today.
Yes, you can start.
Okay.
It's been a great honor to have both Associate Professor Dr. Siavasyari and also Assistant Professor Dr. Hilal Shaheen. I would like to apologize for any shortcoming from our organizer. So on behalf of the organizer, I would like to express our deepest gratitude. Thank you very much for your wonderful presentations and for your kind participations. I'll see you again in the next session, inshallah. Assalamu
Thank
alaikum
you.
wa rahmatullahi wa
Thank you,
barakatuh.
Sam.
Thank
It's
you.
pleasure
Please
of
take
us.
care. Yeah.
But I said associate professor, Mrs. Halal Shaheen. Inshallah, you will be associate professor.
Inshallah, inshallah. Ameen.
Inshallah. Thank you. Thank you so much.
Have a nice day. Have a
it is
nice
Yeah.
day.
pleasure,
Thank
Have
you.
a nice day. Please take care, everyone.
pleasure to be here.
Thank you.
Yeah.
Thank you.
Thank you.
Assalamu alaikum. Bye.
Aleyküm selam.
Corina. Halal Shaheen, rotet şunu da kuşumu bir yerlere beden yecbisiye. Bir katı bakayım. Çocuğu katı bakayım. Halal Shaheen
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. I am Dr. Kauthar Bayoumi from the Academy of Islamic Civilization, Faculty of Social Sciences and Humanities, University Technology, Malaysia. Welcome to our session. Sorry for the technical issues that we have to start late, but I think we have still enough time. We can to present all our presentation. And of course, I'll be moderating this session, and the theme of this session is management, specifically health system management. And I welcome you all, our audiences present and our participants in this session. And of course, let me just without any further ado, just move on and start our presentation. And we have our first presenter, Adila Zakaria. She's already present here, and her paper entitled Islamic Quality in Instant Hospital Design for Non-Critical COVID-19 Patients in Malaysia. So Adila, welcome, and please, the platform is yours. Proceed with your presentation.
Okay, thank you, Dr. Kauthar. Oops, sorry. I'm not sure how to. Can I share the? I don't know how to
Yes,
share.
You can find under the screen that an icon.
Oh, the share. Okay.
Yeah, share. Yeah.
Screen. Share based on the computer. Okay. Application window. Okay.
Okay. Yes.
Okay.
Here.
Okay. All right. Okay. Assalamualaikum and good afternoon. I'm Adila, PhD candidate from Faculty of Built Environment and Surveying. I will present the paper of Islamic Design Quality in Instant Hospital for Non-Critical COVID-19 Patients in Malaysia. Okay. As we know, COVID-19 has become a global pandemic on March 2020. But the first case in Malaysia detected on 25th February from the people who coming back from the origin of COVID-19, which is Wuhan, China. From that time, there is no medication or any vaccines to prevent the spread of the virus. The only way to control the spread and the transmission of the virus is suggested by WHO is quarantine. WHO suggested quarantine to person from the travelers from outside, and also the contact of the known cases. Okay, so actually the quarantine is not the new method in medication. It's the traditional way, which we also know from Islamic medication era, where even Rasulullah also mentioned in his hadith, there is no superstitious infection, but do not mix with sick and health. So that is the means of quarantine. And then so Malaysia until today is the third wave. The COVID-19 hit Malaysia. So therefore Malaysia government under Ministry of Health collaboration with Jabatan Kerja Raya Malaysia has built instant hospital to cater all the cases in Malaysia. And because of right now they have about 336 quarantine center, which is consists 72 instant hospital, or they call PKRC, Pusat Quarantine Risiko Rendah, low risk quarantine center to cater COVID patients and also person under investigation and person under surveillance. Okay, the first quarantine center or instant hospital in Malaysia is in Akep Nilai to cater the first group of Malaysian who coming back from Wuhan. And then the largest quarantine center in Malaysia is MAIPS in Serdang. This MAIPS can cater about 1,650 bed at one time. And now they also cater for critical patient, which is they can cater about 19 patients in ICU in one time. Okay. So the quarantine center or an instant hospital cater for COVID-19 patients stage 1 to 3, because for stage 4 and 5 they will transfer to hospital. And then also cater for PUI, which is person under investigate, and PUS, person under surveillance. So Malaysia as a multiracial country with Islam as the official religion, so Islamic principle should be considered in the design to promote Islamic awareness, enhance the self-esteem, gain Allah mercy and forgiveness. And this concept of quality of Islam should promote mercy to all mankind, and regardless all the religion and regardless the races. So the doctrine in Islamic principle is between man and Allah, between man and man, and man and environment. So as underlined in Islamic built environment framework, Islamic design quality is not only an aesthetic or superficial, but also the important of the values of these six aspects, which is tolerance, human comfort, cleanliness, intelligibility and user-friendly, natural environment, and safety and well-being. So this study to focus to gauge the consumers' satisfaction with all these six values. So the question, the research question for arise is what are the values to measure the implementation of Islamic design quality in an instant hospital or quarantine center? And second is, what is the level of satisfaction on the Islamic design quality in an instant hospital among Malaysian? So the implementation of this Islamic principle in this design of this hospital will enhance the healing process. So the purpose of this research to study the fundamental Islamic design criteria focusing on instant hospital for non-critical COVID-19 patients in Malaysia by sieving through the opinions of the public, especially those from healthcare industry. So the method of this research is this research is descriptive and survey based. It's a qualitative and quantitative research. So the primary method is by survey, and it's supported by media content analysis as secondary data. The survey has been done through structured and semi-structured questionnaire. Require respondents who are the healthcare staff in the instant hospital, and then the COVID-19 patients, stage 1, 2, 3, the person under investigation and person under surveillance, to answer the statement and the question through online survey. We are targeting at least 60 respondents to participate in this survey, because we have six values. So this is as mentioned, the method is followed like Hare et al, which they asked to at least have 10 respondents in one question. So we evaluate 6 values. The tolerance, we need the respondent to give their satisfaction on socializing area, eating area, and management. For human comfort, their room and sleeping area, the privacy, the peaceful, and the thermal comfort. And then the cleanliness, about the toilets and bathrooms, the prayer rooms, and the kitchen. Intelligibility and user-friendly in their arriving area, reception room, easy access, and space arrangement. For natural environment, the natural element, natural lighting, natural ventilation, and biophilic design. And this is for safety and well-being, the access, security area, and surveillance. So from the survey, the findings is divided into two, which is satisfaction and implementation. The respondent has showed give the satisfaction level among respondents for each value is just satisfied, because this is from the questionnaire give a scale from this most satisfied until most dissatisfied. So almost all the respondents just satisfied with the value at their quarantine place. This quarantine place, but the privacy and comfort satisfaction level are way better in hospital. This is based on the survey. The patient who is placed in the hospital more satisfied on privacy and comfort rather than patients who were placed in big hall like MAIPs. And then the highest satisfaction levels for both are about safety and well-being. And then both for hospital and also other quarantine center has lack of natural environment value. Okay, this natural environment value is important because in Islamic design, the relationship between human and environment is one of the main aspect that need high concern by the designer, and it can help to reduce stress or anxiety. And then there are three factors influence satisfaction level. First, the type and condition of quarantine center, because they are placed in different quarantine center. So some quarantine center have very good equipment, and some are just average. And some of them are placed in big numbers of quarantine patients, and some are placed in individual rooms. So the type and condition of quarantine center influence their satisfaction level. And then the status of the respondent, either they are COVID patient or they are person under surveillance or person under investigation. Okay, even if they are COVID-19 patients, also if either they are stage 1, stage 2, or stage 3, this is influence them to give their satisfaction level. And then the third one is the respondent acceptance and expectation. Okay, some respondent they have their word, they have the terms redha, so they can accept whatever they receive, but some expect more, they will be cared very well. Okay, and then this is give the influence on the satisfaction of their quarantine place. And then for the implementation, majority of the respondents agree that Islamic design quality have been implemented appropriately in instant hospital. It's about 80% agree that Islamic design qualities implemented in the instant hospital or quarantine center. Just 20% disagree. But there are four main issues rise the concern, which is the natural environment. As I mentioned before, very lack of natural environment. As like for example, in the MAIPs, they don't. If they are already quarantined in the MAIPs, they cannot go out until the 14th day, which is the final day. So they just sit in the hall without any natural environment. And then the second issue is privacy, because they are placed as we can see in the picture. There is they just separate by partition, and there's no curtain or wall to cover for privacy. And then the arriving, they said most of them have to wait more than 3 hours after arrival at the instant hospital or quarantine center before they were placed at their specific place. And then the praying area, in some quarantine center or instant hospital, praying area is very limited or small, just small space. But most of the patients is Muslim, so they said it's very limited and very restricted to go to praying area. So Islamic design quality shall consider on issues concerned by include natural environment in design, and then the privacy setting to protect aurat issue. Even though between male and male or female and female, we have aurat issue. And then the intelligibility of arriving area to reduce anxiety and stress, because waiting for 3 hours is quite long, especially for unhealthy person. And then we have to emphasizing on the comfort and practicality of praying area. And the last one is tolerate and friendly towards non-Muslim, because there are non-Muslim also placed in the instant hospital. So as a conclusion, this research is beneficial for Malaysian administrator and professionals in the environment industry to gain better understanding and more comprehensive information on Islamic design quality. So this result will help designer to design better environment with implementation of Islamic quality for instant hospital and also hospital in future. So because thank you.
Thank you, Adila, and for this interesting presentation. And we would like, just because we have short time left, we will move to our second presenter, but just be with us at the end if you have 10 minutes for any questions and answers from the audiences, if there are any. Okay, thank you so much once again for your interesting presentation. And now we move forward to our second presenter. Please proceed, and the platform is yours. Okay, our second presenter. Yes.
Assalamualaikum and good afternoon. My name is Halija Ibrahim, and the title for this presentation is Online and Remote Group Exercise Utilizing Fitness Apps During COVID-19 Quarantine. And there are 3 other members for this research. That is Zainal Abidin Zainuddin, Asha Hasnimi Muhammad Hashim, Yana Zulaika Abdul Ghani. And we are from School of Education, Faculty of Social Science and Humanities, University Technology, Malaysia. So, currently there are 2.57 million of death toll due to COVID-19 worldwide. And due to this big number of death toll, so it's become a very big concern to us. And without knowing that the world also faced another pandemic in which people in this world has been living with for a number of years. And according to Hall, Ledoux, Phillips, Levy, and Arena in 2020, this another pandemic issue is related to the physical inactivity and sedentary behavior. So actually, currently, the world is facing two pandemic problems simultaneously. That are the COVID-19 as well as the physical inactivity and sedentary behavior. So, due to COVID-19, everybody have to face a new normal of life. And many countries enforce the movement control order as well as social distancing. This is just to reduce from the spread of the disease. But without our awareness or without our concern, this MCO or movement control order indirectly been supporting the physical inactivity, sedentary behavior, and now it's become a screen-based lifestyle. Because of COVID-19 pandemic, so the MCO is enforced, and due to this MCO, so everybody need to stay at home, and this may decrease their individual outdoor mobility. And due to this MCO as well, many places or business or social interactions, institution or public services have to be closed, such as gymnasium, recreation and fitness center, outdoor park, theater, and restaurant and gyms. So this closure have limit the activities of people in the world. And specific to the college student, many institutions conducted online classes and all face-to-face classes were cancelled. And previous studies shown that the college student reported 7.8 hours or 13% more weekly sitting after the cancellation of face-to-face classes. So it's increased student more sitting rather than doing physical activities. As previously, when students have to go to the classes face-to-face, at least they have to go to the class either walking, cycling, or whatever, but it's reduced their time from sitting in front of the screen. And with current development on mobile apps, and study also shown that the physical activity apps use was positively related to overall change in physical activities. And it's shown that the development of mobile apps does not require the adoption of new hardware. So it's shown that the physical activity or fitness application have the potential to be cost-effective way to promote physical activity. So this current situation of COVID-19, with the MCO orders, and to reduce physical inactivity and to reduce screen-based lifestyle. So it seems like the mobile apps or utilizing the mobile apps have the potential to be cost-effective to promote physical activity. So therefore, the study is to see the potential of mobile apps related to physical activity to encourage students to be actively involved in physical activity. So this is our conceptual framework on online and remote exercise. So basically due to COVID-19 quarantine, so everybody has to stay inside and we afraid that the health and fitness reduce due to screen-based inactive lifestyle. So our study, we try to find suitable physical activity and try from the online physical activities and exercise program. So many online and physical activity or exercise program can be conducted whether synchronous or asynchronous. And these online physical activities can be used to train or monitor the activities of the participant. And this online physical activity also can be conducted either individual or in group. And we hope by conducting online physical activity program, we increase this the physical activity and we come up with a new screen-based active lifestyle. So we try to avoid the screen-based inactive lifestyle into a screen-based active lifestyle. So this is our research activities on online and remote exercise. Okay, so we conducted the study among college students. So about 18 students participate in these studies because these students are required to have online learning at their place and they are during that time they are in a situation of inactive lifestyle. So our study have planned exercise, physical exercise for this group, and we select a suitable self-administrated physical fitness testing procedure because we want to study the effectiveness of using mobile application fitness during exercise. And so we try to find a suitable physical fitness to see the differences before and after the participant doing exercise using the mobile apps. So we identified 9 physical fitness testing. So okay, this study is experimental studies where we have a pre and post test. So the pre-test is we try to find a suitable self-administrated physical fitness testing, and we identify 9 items, and the student need to select a home-based fitness apps, and basically we divided the participant into 2 group of physical fitness apps, that is HIIT workout and 7-minute workout. And after the student finish doing the workout for 9 sessions, okay, for 3 weeks, they will conduct a post-test physical fitness. So actually they are implementing the physical fitness application online individually, but even though individually they a group of them using the same application. And after that, after we do the post-test physical fitness, we analyze the data and compare the differences of pre and post between 2 groups of using different physical fitness application. And we try to find the potential of the online and remote group exercise. So this is our findings. So basically, there are 18 students participate in the studies, and 8 students using the HIIT workout, and 10 students using the 7-minute workout. And from the 9 physical fitness tests, shown that everybody increased their performance from these 9 physical fitness tests. And when we analyze the differences before and after using these 2 mobile apps, it's shown that the mobile apps have different effect on the performance of the student. When we see here like the mobile apps A, that is HIIT workout, it shows that the student have performed good in vertical jump, but not for mobile apps B, that is 7-minute workout. Have a different findings. And also in balance, there's a good performance shown in mobile apps for static balance eye closed, but not in the HIIT workout. So as a conclusion, it's shown that the physical fitness improvement can be improved using the exercise guided by the physical activity mobile apps, and it shown the good potential of the mobile apps in encouraging people to more actively in physical activities. And each physical mobile app focus on different component of physical fitness. So everybody, people need to select a suitable apps that's suitable with their individual goal. And from the study, it's shown that exercise can be performed in groups via online. And it's shown also that By using the same mobile apps application, it motivates others to exercise and gain improvement in their fitness, in their physical activities. So that's all my presentation today. Thank you.
Thank you. Thank you very much, Associate Prof. Dr. Hadija and co-authors for this interesting presentation. And I think we have only 8 minutes left. So let us see if we have any questions and answers from our audiences. I think we don't have any questions until now. So no further questions or any feedback, comments from our audiences. I think with that we can conclude our session. Many thanks for our presenters, Adila, and the interesting presentation. Thank you so much for being with us and for this presentation, and also for Associate Prof. Dr. Hadija and the co-authors. Thank you so much and stay well. And Assalamu alaikum wa rahmatullahi wa barakatuh.